Yeah, Rein is the CEO of FHIR. He's a guy that dedicated his life and has a very incredible team from the Netherlands that are really pushing this new healthcare data standard, solving a huge problem in healthcare that has been fixed in other industries. And it's like a curious case about why we don't have that yet in healthcare. And so we're going to be talking about different industries and also talking about what makes this an opportunity in healthcare.
We're a software company and we're in the health interoperability space, meaning that we build software that enables data exchange in healthcare. We're a small company, we're a startup, we were founded in 2015. And we have our clients are mainly in North America and Europe, especially in countries that have adopted this FHIR standard for interoperability. Yeah, we're a technical company, software developers mainly, and I'm happy to be the CEO and founder of the company.
And it's quite a team that's very inspiring. Also has one of the actual founders and creators of FHIR. And you guys do consulting services, but also run the premier FHIR event of the world called Dev Days coming up in 3 days. So we'll also definitely want to talk about that very soon. But I encourage everyone that is, especially if on the technical side, if you're on the back end or if you are a developer, even if you are a digital health entrepreneur, you want your team to understand more about FHIR. We're talking about how this year is different, of course, because it's a virtual edition, and you'll get to know more about it. Really quickly, I just want to give a shout out. Of course, we're Health 2.0 Egypt. We're the official chapter of Health 2.0. We are partnered up with T20, a network of change makers in Egypt that have been helping us spread the word. And also special thanks to Eva Pharma for providing this platform. The reason why this webinar has been important is, there's a lot of talk about whether this is a black swan event. So is COVID-19 something that we haven't expected to happen, but is actually changing a lot of things, including how we interact in events. And really the core of this is to co-create. So we're going to give you some time in the end to ask questions. But if you guys have any questions that pop up, please use the Q&A button and not the chat. So when you post something in the Q&A, Rein and I will be able to see it, and I'll make sure I ask him as many questions as possible. Lego is something, so this slide, I've had it for all of my webinars so far, but Lego specifically and co-creation is a huge part of interoperability and how people can create together. And so we're gonna start, and Rein, I'm going to give you show you an image and ask you a question, if that's okay with you. And I'd like to get your feedback on that. That's how we're gonna structure it. So we're gonna do that for about 45 minutes, and then give people some time to ask. So are you ready for my first throw?
Absolutely.
So this first, it's more than an image, it's a GIF, but we've all been following SpaceX, of course, recently, and being able to put two people in space, take them all the way to the International Space Station at a fraction of the cost that we used to do. And so I've been looking at the International Space Station, and I found this video of how it is built from components that we have, as human beings, hurled into space from 5 different countries that have devised these components, mostly from Russia and the US. People, 2 countries that don't normally like to collaborate, but they've been able to do that in space through these adapters. And I found that metaphor to be very relevant to interoperability. So my first question to you is how come we're able to do that at such a sophisticated level in outer space, and not being able to do that in healthcare? So, this idea of hospitals speaking to each other and building things together. Where are we when it comes to interoperability in healthcare, and what are you seeing now as trends?
Well, I like that picture, Omar. Well, first of all, I think they have the brightest minds in aerospace, right? And maybe that's it. But I'm not an expert, of course, in that field. But Well, you have to. I think you have to keep in mind that space travel has always been something that has captured the imagination of people. It started with the Apollo mission with the man on the moon, and that really captured the imagination of a lot of people. I think that's very important. And I think 10,000s of people have worked for a decade or so to work towards that single, very pinpointed goal, right? Putting a man on the moon.
Yeah.
And I think it's amazing what people can do if they have this one single goal that they all adhere to. Now, when you compare this single goal of putting a man on the moon, and you can succeed or you can fail, right? You do it or you don't. But in interoperability, it's a different beast. It's not a single goal. It's diffuse. It is a different kind of goal, and it's not a matter of you succeed or you fail. It's a matter of more or less. So that's one huge difference here between the spacecrafts or the launch of a missile like we saw with the SpaceX. Interoperability, if I for instance, if I send you a PDF, or the lab sends a PDF with a lab result to the GP, to the doctor, and the doctor is able to click on the PDF, and here's the PDF with the lab result. Now, that's not much of interoperability, right? You would expect the lab result to end up in the patient file. I mean, the single data. But it's not a lot of interoperability, but it's more interoperability than, for instance, the fax, the lab result coming in through the fax. So that's a huge difference between, I think, the launch of a missile or the single goal.